Hello. So good afternoon, everyone. Apologies for the slight delay. All right. So today we are here to talk about the prevention and management of heart illnesses. Now, before I proceed, just a brief introduction. September 29th is regarded as the World Heart Day. It's a day set aside to inform people around the world about the impact of cardiovascular diseases, including heart diseases and stroke. It's the world's leading cause of death, claiming 18.6 million lives every year. Now, what this day does is that it helps highlight actions that individuals, private organizations, corporate settings, the government, actions that we can all take to prevent and control CVDs, as well as encourage heart healthy living across the world. Last bit of information, which I think is very important. At least 80% of premature deaths from heart diseases and stroke can be avoided. All right, so without further ado, I will introduce our guest presenters, Dr. Folasade Alli. We've done this before. This is quite good. So Dr. Ali, she's a consultant cardiologist, a cardiovascular researcher, and board certified adult cardiologist. She's got over 30 years of experience, career devoted to the diagnosis and treatment of heart, vascular, and thoracic diseases through early detection, education, and prevention, primarily in Nigeria. She currently serves as the Medical Director and Chief of Cardiology at Lagos Executive Cardiovascular Center, LECC. Our area of expertise includes heart attack, heart failure, cardiac asthma management, acute coronary syndrome, coronary artery disease, chest pain management, arrhythmia case management, among others. So, Dr. Ali, it's good to have you back.
Thank you very much. Good afternoon to you all.
Yes. So, I think I can start with the very obvious question. Now, for everyone listening out there, what does it mean, Dr. Ali, when we say cardiovascular health?
That is a very nice question. What does it mean when we say cardiovascular health? That is looking after your heart and the blood vessels. Remember, when a woman gets pregnant, and then for the obstetrician to say, "Oh, congratulations, madam, you are going to have a baby very soon." That is at 6 weeks of age or 6 weeks in the womb, the heart is already beating. The obstetrician can see the heart beating, and the blood vessels, pumping, and everything is just, is expected to do. Congratulations, madam. Your heart is, your baby will be born, in 9 months. So what we mean by cardiovascular system is the beginning of life and the end of life. So therefore, it's a very important organ, the heart and the blood vessels. And this is what makes, when we say there is life, it is the heart and the blood vessels makes life.
All right, Doctor, thank you for that very comprehensive introduction. My next question is a very obvious one. Most of us are aware that there are different kinds of issues, different kinds of heart diseases, so to speak, that can manifest due to poor cardiovascular health. So can you please give us some insight on these kinds of issues or diseases?
Okay, the heart and the blood vessels, cardiovascular, health, are influenced by quite a number of things, and the things we do, the activities that we do on a day-to-day basis, what it is our total health, and then what we eat, everything, what we are exposed to on a day-to-day basis, how we manage our living existence, everything affects our heart and vascular health. Albeit, we also have some situations that are inherited. We have, inheritable conditions, whereby there is an idea that you don't choose your mom, you don't choose your father. So there are some familiar inheritance diseases, that, you know, if the child inherits again from the womb, you know, and then manifests as the child grows up. So that's one you cannot, that's what we call biological problems, and you can't avoid it. And of course, there's the environmental issues that come in as you now grow up. These environmental conditions affect the heart and the blood. So there is what we call innate, inborn, inherited problems, and there is what we call environmental, you know, associated problems. So everything coming together influences the heart's health and the blood vessels. So among the ones that are inheritable or passed down through inheritance is high blood pressure, you know, diabetes, you know, cardiac, you know, conditions, even heart attack when it has occurred in a family member, very close relations. Obviously, some other people will also pick it up. We have some congenital malformations that can grow up into adulthood, you know, from children into adulthood. So we have quite on that one we cannot influence. But we have environmental problems, our habits. When you smoke, when you drink excessively, when you don't act, you know, physically inactivity, what you eat, what you consume, you are what you eat. Lots of fats, lots of not careful about what you are putting in your mouth. All these things affect the heart and the blood vessels. They are quite a number. Even the hours to sleep, you know, the hours to sleep, your day-to-day commute on every day, your financial stress, your marital stress, your physical stress, all of them encompassing, you know, so that some things that are already dormant, when these environmental issues adds on to it, the dormant conditions becomes manifested. So, but for women, then we also have pregnancy. And I will always like to mention women because they are special, not because I'm a woman, because we are special breeds. You know, so when pregnancy comes in, wanting to have the baby and having the baby, you know, post-delivery, so women also, you know, have other, you know, peculiar problems. So this everything compounding together, and they can also, and of course, the drug we take, you know, the medications that you take also affect it. When even the water that you drink affect the heart, even and the blood vessels. The air that we breathe in, polluted air, too much generators, fumes, car fumes, so many things, you know, affecting our heart and blood vessels health. So by and large, and of course, conditions that also develop from other, you know, systems can also affect our heart health at the end of the day. When people have cancer or any of these conditions, they also affect the heart and blood vessels at the end of the day. Because I say the heart and blood vessels at the beginning of life, and of course, they are at the end of it. So they are affected by everything that all human beings come across as we journey in the journey of life. So we have to take all this into consideration when it comes to the heart and the blood vessel cardiovascular health. And of course, they pose a risk to the proper functioning of the heart. All these things that I've mentioned before, they pose a risk to the heart and the blood vessels functions. Thank you.
Thank you very much, Doctor. That was quite comprehensive. Thank you for that. Dr. Ali, I mean, as a doctor, I know that there are different kinds of heart diseases. We have the cardiomyopathies, coronary artery diseases, but generally speaking, are there certain signs and symptoms that when it comes to heart diseases that people should generally pay attention to?
Oh, definitely. I always tell people that what you're having now did not get it, did not get there now. It's been there for a while. Possibly you were not, the individual is not paying attention, to it. So there are some symptoms that whether you are young or you are old, that can manifest from cardiac condition, whether cardiomyopathy or coronary heart disease or peripheral arterial disease. There are some conditions that there are some symptoms that individual will begin to manifest, and then you know that something is wrong. You need to visit your GP and quickly outline. Some of them, a few number, is top of the list is some form of chest pain. For example, you don't usually have chest pain and you begin to have chest pain. At least you should check it out. Something you don't have before and you now start having. Check it out. Number one is chest pain. It may not be from the heart, but alas, it can be from the heart. When you begin to breathe heavily, normally you go around your house, without issues, or you are good at doing exercises, and then you walk up. You walk 500 meters, 1,000 meters without any issue before, and then you start, panting excessively. Before you get to 200 meters, you begin to breathe heavily. Then it shows that there's something wrong somewhere. Therefore, the individual needs to begin to check, what is underneath. And then again, individuals developing what we call fainting spells. You begin to feel faint, or you begin to feel dizzy, or even your heart begins to palpitate, what we call palpitations, fast heartbeats, unnecessary, or you suddenly wake up, from sleep, fighting for, I can't, looking for breath around your room, even when the AC is on, then you know that something is wrong. Or you lie down, with one pillow, you are not comfortable, you are looking for, extra, or you need to sit down to breathe properly, so these symptoms are quite a number. Running up a flight of stairs or walking up naturally up a flight of stairs, you don't have any problem. And now you begin to feel, you are tired, you are feeling weak, you are short of breath, you are out of breath with just a flight of stairs, then you know that something is wrong. So deviations from normal, when you begin to have symptoms that are deviated from your normal, then you need to check it out with your GP or with your specialist. At whatever age, this can occur. So it's quite numerous. It's cool. Even when you don't sleep, normally you are a good sleeper. Once you eat your bed, you are off. Then you begin to find that you wake up, you can't even sleep well. You wake up and then you can't sleep again, and that continues to reoccur night after night. Your eyes are wide open. You can't even understand why your eyes are wide open. Then you know that there's an issue somewhere. Something is talking to you, and it could be your heart saying, "I'm not feeling well." So the symptoms are numerous, and individuals should just check up once you are deviated from your normal situation to something that is not it's not what you observe. It's something. You're now observing something different in your health. Then you need to speak out. You need to talk out. You need to look for help before it is too late. Thank you.
Thank you very much, Dr. Ali. Thank you for that. I like that. Just to sort of talk about what you just said, chest pain, very important. We look out for that. Exercise tolerance or easy fatigability, getting tired easily is quite important. And any deviation from the norm. So individuals listening, you notice any of these things, please present at your hospital. Very important. Now, Dr. Ali, this is a very common thing that I get to hear a lot from different people. Cardiac arrest, heart attack. So let me ask you now, as the cardiologist, is there a difference between cardiac arrest and heart attack? If there is, what should we all do as a first response to any of the two conditions?
That's a very nice question, Mr. Moderator. There's a difference between cardiac arrest and heart attack. When you say there's a cardiac arrest, it means there is no cardiac activity. The heart has stopped beating. So it's an emergency, it's a very, very acute emergency. And with that, for a first responder, that is why we say there must be people who are first responder who can do CPR, cardiopulmonary resuscitation. That individual requires our assistance to quickly do something, even a tap on the heart, on the chest, by the first responder can start, like jump, when the battery of your car suddenly got flattened, you know, and then you have something to, you know, this jump starter, you know, and then you jump start it, you know. So that is what the heart needs at that point. And cardiac arrest means the activity, cardiac activity has come to zero, no more beating. So you need, the individual needs to be helped, and a first responder is very important. Activity of the first responder to restore, you know, to restore that heart to beating, to start beating is very important. So a CPR, cardiopulmonary resuscitation, as simple as 30 cardiac compression to 2 breaths is what the individual needs at the breastbone, you know, with the flat of your palm, you know, like that, you know, and like that, you know, 30 cardiac contractions to 2 live breaths will help the heart to jumpstart the heart. Now, heart attack is kind of, you know, often time is somebody still alive. That is, the heart is still beating. It simply means that the flow of blood to the cardiac muscle has kind of been jeopardized. There's a reduction in flow of blood to the heart muscle. You know, the heart is a beating organ. It beats every second, every minute. So it's a high, what I will call high maintenance organ, high maintenance. You know, so it needs blood. So when blood supply to that cardiac muscle is impaired, then its kind of activity begins to slow down. So therefore, individual can suffer heart attack, and in fact, you can suffer heart attack because it has different degrees. There is a mild one that people will not even know that they suffered a heart attack, and they continue with their normal business. So the person is still alive. You know, the person can do what you are even doing with heart attack. But again, once that occurs, the individual must seek again urgently for assistance, intervention, because if nothing is done, it can rapidly degenerate to cardiac arrest. If nothing is done, you know, because it's also an emergency situation, and the individual must seek an assistance immediately. And you've had instances of people who have suffered that attack, even driving themselves to the hospital. Yes, you can drive yourself to the hospital with heart attack, and then from there the doctors pick it up. So one, the heart has stopped cardiac arrest. The heart has stopped beating, no more activity. In fact, the patient is unconscious. The patient is almost confirmed dead. But meanwhile, heart attack is still a living soul. The heart is still beating, is still trying to cope, trying to do his work, but requires an assistant immediately so that it does not stop. So it's a crying heart that requires urgent. In the situation, in both situations, they are, you know, crying hearts, or a heart that requires attention, urgent attention. Thank you.
Thank you, Dr. Ali. That was very, very, very good. I really enjoyed that. Just to sort of summarize what you just said, for cardiac arrest, CPR is quite important. For heart attack, straight away present at the nearest health facility.
Oh, yes.
Fantastic. Thank you very much. Earlier in your presentation, you talked about women being very special. I agree with you on that. But unfortunately, research suggests that women are twice as likely to die from a heart attack than men. Also, some studies have also said that symptoms manifest slightly differently in women than men. Can you help us make a distinction between symptoms and between men and women? And this will help women pay more attention to those particular symptoms.
Thank you very much, Mr. Moderator. You can see me, I'm wearing red. You know, red by the WCC, World Cardiology body. We have used red as slogan for women. Red for women, means standing up red for women. That is red alert for women. You know, really, as you have rightly pointed out, many women die from cardiac conditions than men. And as you rightly said, it's because their symptoms differ. Now, I will start with men. Men, we said earlier, when there's a cardiac condition, most often time, chest pain. And men will suffer, active chest pain. There will be, with men, there will be active chest pain. Oh, I have chest pain. Oh, there's this chest pain. That is men for you. But women may not even experience chest pain. And even if there is chest pain, the chest pain is very subtle. Their symptoms are subtle. The chest pain may be in terms of, oh, I think I'm having indigestion. As if, oh, possibly it was beans the woman ate yesterday night. So the chest pain is not clear cut, it's subtle, it's not active, it's not action packed. Every one of us can have indigestion, but and that indigestion a woman is suffering might simply be that she has already begun to have, reduced blood flow to the myocardial muscle, to the heart muscle, that she should have paid attention to and seek, intervention. But because it's not action-packed, because she's still able to go about her normal businesses, she will just, she may not think about it. But the man with action-packed chest pain will immediately present in a facility. So that is one subtlety. Now, with men can begin to, have things like nausea, vomiting. Their own is more action related. As I said, they have jaw pain, neck pain that is so obvious that will not jaw pain to the neck, pain to the left shoulder or to both shoulder. So it's there. It makes sure that this pain does not allow them to do what is expected of them. A man, he wants to meet up with his appointment. He wants to do what he normally does every day. But this pain prevents him from doing them. But unlike women, the neck pain or the jaw pain is subtle. She doesn't even think much about it. She's still able to go prepare the husband's food, look after her children, do what she wants to do her hard chores. Because the subtlety of this, it's not that they don't have it. They do have the symptoms. Women do have the symptoms, but it is of a lesser degree. That is what we are talking about now. It is of a subtle degree. It's lesser because women are usually not very aggressive. Sorry to use that word, but not action-packed. So they is subtle in their, and then the subtlety of their symptoms is what actually differentiate them from men. And the fact that women, because the condition has been going over time, they now can develop what we call, just feeling tired, just a bit weak, just, something that you and I can manifest on a day-to-day basis without any problem, but yet this woman has not seek for attention, and therefore, by the time they present to the hospital now, so you can see the time lag. There's a time lag in their presentation. A man will present because there's acute onset and it's action-packed, is delaying, has actually made the man not to function normally, so he has to present in the hospital. But a woman is subtle, is still going about her normal businesses, can do what she's doing, although it might be at a lesser degree, but she's able to cope. Therefore, the cardiac damage, the muscle myocardial damage is become more extended and more deeper. So by the time they present, oftentimes they present rather very late, and sometimes that is why they die more from the condition, than men who seeks attention early, who has action-packed symptoms, but the women are subtle. A woman can even say, "Oh, all I have is just even some back pain," and I feel that as I'm able to go about my normal businesses, then I don't have any problem. So it is the subtlety of the symptoms and the fact that the symptoms in women, are more gentle. Their development of the symptoms is more gentle. It's at a lesser degree. and therefore she's able to do many things. But the damages continue. The myocardial damages continue. And so by the time she gets or seeks attention, a lot of the myocardium has been disturbed or has been damaged and they succumb easily, to the disease. That is just it. So we are now saying that women should pay more attention. Our men should please, because a woman is more, you see her more concerned about her husband and her children, and they relegate their own health to the background. They always relegate their own health to the background. When patients come to the hospital, men, I will say, what about madam? Why don't you bring your wife? Bring her. Is it because she's not, the man will say, the husband will say, but she has no complaint, but the husband will say, but I have this complaint, I can't even do my work. But she's going about her normal business. So men, we need to stand for their women, for their wives, so that they can, help them to live longer. And that is what I will say, I will plead. So the pleading now, going red for women means, be more proactive for women's health. That is what we're saying. Go red for women. Be more active, taking the decisive action. Our men should take decisive action. They should take their women along with them to the hospital, on time. Not they presenting themselves alone and leaving the woman, in the house to continue the shows. So they need to come with their women as they are doing health assessment for themselves. They should bring their women along so that they can, we can catch the disease. We can pinpoint the problems early, intervene early, and therefore gain women health. So these are all the differences. The community at large, we also help women. We also help women, by making sure that once you see a woman who is just not coping, she's doing her job, but she's not coping as she used to do before, then you should make sure that that woman's heart health is checked, and then we can recover her heart health instead of letting her succumb to the disease. So those are the proper identified problems. So it's not as if the woman will not have chest pain, but it's of lesser degree. It's not as if the jaw pain or neck pain, but it's at a lesser degree. Women will present with shortness of breath, but because they are still able to do their short tools, they say there is no problem. And they might be fainting, especially indigestion. I've seen that one before. I know the story. I can remember a patient of mine. All she told me was why she was working. Imagine, she came to work. She came to the office. She came to the hospital. She was one of my staff. I don't want to mention the hospital. And she came to tell me, Dr. Ali, I'm just having indigestion. I know I had late yesterday night, but since I woke up this morning, that was the woman. She's late now, just as we are talking this morning. She's late. I later had about 3 or 4 months down the lane, she died. Then she told me this morning that I'm just having this indigestion. I don't know what is happening, but I've been treating her for high blood pressure, which we have been managing high blood pressure and diabetes. But then she came this morning, she presented that morning. Oh, Dr. Ali, I have this indigestion. I don't even know. I knew I had this yesterday. I ate late. I was preparing my husband's food. And from there, I prepared my own and ate. But since morning she woke up, all she had was indigestion. So the women have atypical symptoms as well. So they may not exhibit that chest pain, active packed chest pain. So all she was having was, indigestion. And I said, okay, madam, you know what I'm going to do for you? Let me do your chest, let me do your resting ECG. And lo and behold, my presenter, I did the resting ECG that morning, and it showed acute myocardial infarct. Acute myocardial infarct, and by the time we did it, she has gone into florid heart failure. She was admitted, and then we started managing her from there. But she was still, I gave her 1 week off to go and rest. And I gave her 2 weeks off to go and rest at home. And she came back to tell me, Dr. Ali, after 1 week, I'm okay. I'm able to do my normal chores. And I'm like, I gave you 2 weeks. Go and rest at home. You need to rest. You've suffered this problem. After we have managed you, you should have at least nothing less than. But she said she's well. She's back to her normal chores in the house. Wow. But so that is women for you. They tend to be more, they relegate their health to the background. So women, we need to wake up. They need to wake up. This is a wake-up call for women that, look, yes, you are able to do your chores, but all is not well. All is not well. So that is a typical example I always remember from my experience. And but 30 from 3 months down the lane, and then the organization terminated the appointment. And this is a woman who was almost like a breadwinner, and then her appointment was also terminated thereafter. And then from there, I just had she passed on. So that is women for you. She could not connect. She could not continue to take care of her children and her home. And then, I think a lot of family issues also set in, and she was just not able to cope. So this is the woman life for you. And I think men are the center of a woman's health. Men, they are men, we need to rise up to help them in this heart health issue. Thank you, Mr. Moderator. I do hope I've been able to explain, the full details, the heart health of women and then the heart health of men. And of course, women, they will also go through pregnancy, various pregnancies. And now more is the issue of what we call in vitro fertilization. Every woman wants to have her own biological child. Is a norm in this society of ours. So women, they will go at any length to make sure that they get pregnant and they have babies. And even when we discover that they have hypertension, diabetes, with very bad hypertension, they will still want to get pregnant. And you have done, but you already have a baby, male or female, it's okay. But they will tell you that no, one is not enough. My husband wants more than one child. I want 2 children for myself. I want 3, and these are all the conditions. So women relegate their health. They take the family too much to heart. They don't take their health to heart. And as I said, in vitro fertilization is making now. There was an article I saw by the WHO that we have 190 countries, and we looked at the health care facility, and we found that Nigeria is 187th on the list of good healthcare facility out of 190 listed by the WHO. Our country, Nigeria, is 187 on the list of good healthcare facility of 190 countries of the world. That is third to the last. And this is from our maternal mortality rate. Our maternal mortality rate. And that rate seems even to be getting worse, because every woman wants to have their biological child. So they present themselves for what we call in vitro fertilization. Now, in vitro fertilization means the use of hormones to ripen the ovaries, the use of hormones to make sure the baby stays put in the womb, the use of hormones, and these steroid hormones, they are very detrimental, putting their cardiovascular health at risk. So now a number of these women who have gone for IVF, they come down with what we call pulmonary embolism, thrombopulmonary embolism, because when they are using these high doses of hormones, they introduce the women to severe blood pressure, what we call diabetes, abnormal glucose metabolism, abnormal fat metabolism, endangering the cardiovascular health of women in the process of doing in vitro fertilization, and not carrying the cardiologist, not carrying the cardiovascular specialist along in the management in the IVF program. It's not that I'm saying IVF is not good. It is, but there are lots of complications. And to God who made me, we are losing women, because I'm seeing it in my practice. Women are being lost to pulmonary thromboembolic diseases, heart failure, severe hypertension, diabetes, DK, what we call diabetic ketoacidosis, severe sepsis from the in vitro fertilization. I'm seizing this opportunity, please, to reach across to my colleagues in the obstetrics and gynecology ward. So please carry the cardiologist along, the specialist along when they are when they are choosing these women for fertility. Yes, it is good, but please, they should know the pros and the cons of subjecting women to in vitro fertilization and what they need to do. Please, what must be done very well. It must be done very well. I'm seizing this opportunity to appeal to my colleagues in the obstetrics and gynecology ward to please assist these women to live, to even be able to look after these children when they eventually have these children from the IVF, to make sure the women have quality of life after the IVF. I lost a friend to complication of IVF from breast cancer because of the large hormone doses that are used for them. Thank you.
Oh, Dr. Ali, thank you very much for that. And I am so sorry. I do understand how important women are, and why we cannot overemphasize their health care. Women, as resilient as women are, as strong as they are, I think a call out as well that they should all try to focus a lot on their health. Okay, whatever they think is going on, please present at the hospital. Don't just wave it aside and assume that everything is fine. Women out there, as men as well, we can do a lot more for our wives, our sisters, our cousins. They complain about any symptom. Let's encourage them to please present at the nearest health facility. As regards collaboration, will also be involved in spreading the word that for IVF cases, mandatory. You should try and involve a cardiologist in the protocol, in the treatment protocol. Okay.
Yeah.
Dr. Ali, thank you very much for that. Thank you so much, ma'am. So to move to the next question, we have talked a bit about this. It's about risk factors. Now, are there factors that predispose certain people to heart illnesses? If there are, what are these factors? As a follow-up to that question, what can we do to prevent heart diseases?
Okay, thank you very much, Mr. Moderator. There are quite a number of risk factors for cardiovascular health. We have mentioned a few. High blood pressure is one of them. Diabetes is one. High cholesterol level is another. Obesity, when you are overweight, you should check up. People should try and maintain a good weight for their health. Because the size of your heart is just the size of your fist. The size of your heart is just the size of your fist. When you fist your hand, this is the size of your fist. So if you are supposed to be 70 kg and you have become 140 kg, I don't know how this size will be able to meet up. The size of this heart will be able to meet up with 140 kg. So please, people should ensure that they have adequate height, adequate weight for their height, what we call body mass index. So that is very important. Sedentary living is not good. We find people sitting back at their table for hours, even during this lockdown. I've had the case of a very young lady, 27, who succumbed to pulmonary embolism because of hours of sedentary life. Sitting, with your computer for hours. And we should begin to talk about this to our, young adults. who sit for hours, pinging on their phone for hours, or seated in with their laptop or iPad for hours is not good. You need to move. You need to keep moving, and that is what the heart and the cardiovascular health loves. And also, what we eat, as I said earlier, is who we have. Is what we have. What you eat, consumption, using your 10 fingers to eat all kinds of things is not good. We need to be sure that we are consuming what we call heart healthy diet. There is their diet that is called DASH diet, which is diet associated with stopping hypertension. DASH diet is there all the time. When you are presented with things to pick diet that slows down development of hypertension, DASH diet. We need to be conscious of what we eat. Then we need to be conscious of what we put into our mouth. When we say wine is good for your health, we didn't say that you should finish a bottle of wine at once. No, you must be moderate in your portions. Moderation in your portions is very important. So, and then people who eat late at night, it's also not good. When you are sleeping, your systems are supposed to be resting. Therefore, when you eat late at night, you subject your heart to still pumping heavily, to having to cope with what you have eaten before bedtime. So please ensure that you eat early and make sure that you don't, the food is digested at least 2 hours after feeding before you go to bed. You must make sure that at least 2 hours after feeding at night, after eating your last meal, before you resume to bed. Some people, they will eat now and they crawl to bed. It's not good. You need to consciously be proactive in all these things that we're talking about. And quite a number of these risk factors, they are symptomless. That is one thing we need to educate ourselves about. Quite a number of them are symptomless. High blood pressure, diabetes, high cholesterol level, even obesity, even they don't have symptoms. So presenting yourself in the hospital, knowing your numbers is number one. Knowing what number is your blood pressure, your blood sugar, your cholesterol profile, good cholesterol, bad cholesterol, is very essential. Uric acid, they are all very essential. Uric acid is part of cardiovascular health. They are all very essential. So you need to go and check them up and make sure that you are to target. In your blood pressure, you are to target. And if you are on treatment for any one of them, make sure you are to target. For BP, for blood sugar, for cholesterol profile, for your uric acid level, and on and on. You have to target with your body mass index, your weight. You cannot leave your health in the hand of anyone. You need to make a decisive effort. You need to be proactive. And that is why we, with this World Heart Day, 29th of September, the hashtag is use your heart to connect. Use your heart to connect to people. Talk to yourself. Talk to others. No, I don't like your weight. You need to do something about your weight. This is what the slogan is for. Educating ourselves, training ourselves on what we need to do. And it must be done. It must be done. So therefore, all these things are encompassed, including our day-to-day activities. Your stress level, please, you need to check it out. You need to check it. You need to sleep enough hours. You need to drink enough water. 3 to 4 liters of fluid per day is essential for your cardiovascular hemorrhagiology. All these things are encompassing, and individual must be proactive. You must wake up. That is the hashtag for this year. Hashtag use your heart to connect. Connect to others. Connect to yourself. In fact, connect to yourself. That have I checked my blood pressure? Have I checked my blood sugar? Do I know what my adequate weight is now? Am I at adequate weight? And of course, taking the action to do what is needful. That is the hashtag for this year. Hashtag use your heart to connect to yourself, to connect to others, to connect with your community, which means speaking out. You speak out. If you develop a symptom, speak out. If you are smoking, you must stop smoking. You must stop smoking. Take a decisive action and stop smoking. Smoking weed, smoking marijuana must stop because all these things affect the cardiovascular system. Smoking among the youth has become the norm of the day, which is very wrong. Our youth should begin to do activities that are heart-friendly, activities that promote good heart health. Therefore, they must shy away, run away from weeds, from shisha, from marijuana, from the use of hard drugs that drives the heart crazy. They must stop. Use of drugs, hard drugs, they must stop this. They must. There is nothing, you can't be in the society and say it's because you want to belong and then destroying yourself. No, you can't say because you want to belong and then destroy yourself. That is what we are talking about in this year's slogan, World Heart Day. Use your heart to connect, which means be compassionate, for your health and for others, for your heart health and for others. Thank you very much.
Thank you very much, Dr. Ali. That was very concise. Just a summary of what you said, because this is actually the crux of what we need to all adopt. Like you mentioned, know your numbers, your BMI, cholesterol levels, just everything about yourself as regards your health. One must know it. Lifestyle modification, I guess, sums up everything you mentioned. Adopt a healthy and active lifestyle. And lastly, sleep. I think, Dr. Ali, I captured everything you said in just those points. The next question, Dr. Ali, is about COVID-19. It's been with us now for about 2 years. And
Yes.
I am aware that studies have also shown that it's more problematic for people with chronic conditions, such as heart diseases. So, insight into the correlation or relationship between COVID-19 and cardiovascular diseases or illnesses.
Thank you very much, Mr. Moderator. There's a body now. They tag themselves CAN COVID. CAN COVID. CAN COVID means cardiovascular health and COVID, and this pandemic COVID infection. Now, it has been discovered by, the research is still going on, but all over the globe. But Italian researchers, especially where the COVID-19 infection was quite heavy, in Italy, in Spain, in quite a number of these European countries, in America, researches keep going on with regards to COVID-19 and cardiovascular health. And topmost that they have discovered so far, more will still come, but topmost that they have discovered so far is that people with cardiovascular ill health, whether you are on treatment for those conditions like hypertensive heart disease, like diabetes, like coronary heart disease, ischemic heart disease, or you are not even treated, but you have the condition. This is where the problem is now. That you don't even know you have condition. There was a presentation I made that quite a number of people that have high blood pressure do not even know that they have high blood pressure. And quite a number, another percentage of those who have discovered that they have high blood pressure, another percentage of them, 50% of them, are not even treating the blood pressure to targets, to WHO targets of 130/80. So these are all the compounding problems. Those who have the condition that knows that are not even treating to targets, those who do not even know at all because they refuse by one means or the other to be proactive about their health, to check up, to find their figures, to find their numbers, to discover what their numbers, they don't even know. So when these conditions are already indolent, they are dormant, they are there. And then the acute COVID infection comes on top. Then situations becomes out of control. Now, with COVID-19 viral infection, COVID-19 viral infection induces in the body system, one, vascular health, production of clots, blood clots, in the blood system becomes elevated with COVID-19 viral infection because of the antigenic stimulation of the COVID-19. You know the speckles, the corona speckles, comes together, cause clotting, what we call thromboembolic clotting, blood clotting, massively throughout the heart, throughout the body. So therefore, this makes somebody who has high blood pressure that is already not controlled, be more susceptible to succumb. The viral infection also attaches itself, apart from the blood vessel, it also attaches itself to the myocardium. I've had the opportunity of doing echocardiography, transthoracic echo, for quite a number of patients with COVID-19 infections. And behold, even from my own little experience, is what I've found. The heart becomes so big, massively big. What we call, so there is a lot of attachment of the virus to the myocardium, causing the myocarditis, causing the heart to become exceptionally big, giant. Acutely is an acute decompensation of the heart. And plus many other vascular problems that are already out of the way. So these are the things that makes the patient require by the time they require ventilator, it means that there is overt heart failure, there is so much thromboembolic, thromboembolism, in the lungs, in the peripheral vessels, and everywhere. Inflammation everywhere. So these are all the things that have been discovered. So the acute inflammatory state that this COVID-19 causes, plus the heart hypertension that is already there, diabetes that is already there that was not discovered or has been discovered but not controlled, then the situation gets out of hand. So therefore, the training, the education today is number one. First, individual, as I've been saying, telling people, this is a new era. This is a new world. And that new world is the fact that people will need to begin to check up their health, cardiovascular health, especially because COVID-19 infection, I don't know, I don't want to say much, but it's going to be with us for quite a while. And the virus keeps changing its variants. That is the problem. So even when we have vaccine today, and it changes its variant to another variant, it makes the vaccine of today useless by tomorrow, or at least not as efficient as it's supposed to be by tomorrow. So therefore, what can you and I do to help ourselves? What you and I can do while this variant of COVID, all the various variants continue to emulate, you and I need to do something decisively. And that is what the World Heart Health Day is for. They are telling us, can COVID-19 people are telling us, go and make sure you discover what your cardiovascular health is. If there have been issues with it, then treat it to target. Your blood pressure must be adequately controlled to 130/80 and below. Your blood sugar fasting must be controlled to target of 100 fasting. Your HbA1c, what we call glycosylated hemoglobin, glycated hemoglobin, must be appropriate to 5.0% or thereabout. Your weight, because it's been known that when there is obesity and when the people develop this COVID-19, it also makes catastrophe, for the cardiovascular health. So, and of course, our activities, our stress level, where are we running to? The whole world was closed down for 1 year. The sun kept shining, it keeps raining, the rivers keep flowing, the air keeps breathing, and yet you and I are locked up. Even the animals that are in the wilderness, they all came out to our own road and start having a good day. So where are we all running to? Please be less stressful, delegate roles. You don't need to be in Japan today, Tokyo tomorrow, London next tomorrow, and America. We have the digital. Do it through the digital. And that is what we are doing now, digital health, telecommunication. Use what is available, the technology, to improve, to lessen your stress, you know. So all this, sleep well, eat healthy, drink enough fluid, and all and all. Because once the condition hits and you are not in good cardiovascular health, people succumb easily. Thank you, Mr. Moderator.
Thank you very much, Dr. Ali. I like the fact that you keep on emphasizing preventive measures, things that we should all be doing to sort of keep our hearts healthy. Thank you for that. And as an addition to what you said, Dr. Ali, and also a question, I don't know if there's also a correlation between presentation in terms of individuals with heart diseases presenting at your facility or other hospitals. To round up, I know you'll answer that question, man. To round up, we've talked about prevention, risk factors, what to look out for. But now let's focus on treatment options or clinical management options for those that already have these conditions. What are the things that, what are the options available first of all, and what should these people do more or less of?
Thank you very much, Mr. Moderator. I will take that your question in two parts. And the first part is that those who have been diagnosed with high blood pressure, diabetes, high cholesterol, abnormal cholesterol, and so on and so forth, and those who haven't been diagnosed. And then the number three question will be how to the management profile vis-a-vis our country, you know, with relation to practicing in third world country, in limited resources country. So I will first say those who have been diagnosed with these risk factors that have been mentioned now, or those who have had complications, even with stroke and so on, I would say that yes, we have the general practitioners, and it is and really this is an advocacy, you know, that those who have been managed, management profile, should from time to time work with their specialists. Yes, they can, because the specialists cannot do everything. The general practitioners will have to do their parts. The general practitioners must update their knowledge, and they must know their limitations. The general practitioners must know their limitations by making sure patients or individuals who have these conditions see specialists in the field from time to time, not all the time, maybe once in 3 months, you know, just send them to specialists to evaluate them again and make sure that everybody is on the same page with the individual's health. That is those who have been diagnosed. They must be consistent, compliant with their medications, with what they have to do, lifestyle changes. It's continuous. They must not stop their medication. You know, they have to be in conjunction, do things in conjunction with their doctor, with their GP. And the GP must know his or her limitation and make sure these patients are reviewed by specialists, endocrinologists or diabetologists for diabetes, cardiologists for hypertension. So at a certain point in time, the GP must know that they need to send these patients for evaluation by specialists and then continue the management from there. And then those who have not been diagnosed with any condition, I want to say this, that in those days, it used to be that grandpa, grandma, the people that have the hypertension, diabetes. But please, I want to appease everybody that these conditions are now more in the 30, in the 20s, 21, 22, 23, 24, 28, 31, 32, 34. Don't wait till you are 40, because if you don't do the thing you are supposed to do now, you might not even reach that age of 40. So therefore, the fact that you are healthy does not mean all is well. People in the workforce, we want healthy young workforce. They must present themselves even now more in this COVID-19 environment, because quite a number of people that are even dying now are those in the late 30s, 38, 37, 36, early 40s, because they have conditions that were not diagnosed, because they did not do the needful. And therefore, when the COVID infection came on top, everything just started. So I have a word for them. Do not wait until you have symptoms before you check yourself up. And if you discover any symptom that is not there before, present yourself immediately to your GP, to the specialist, and make sure that you don't use your heart to connect. Also say that you don't talk, stop talking. Continue to look for help. That is what the hashtag is part of the hashtag slogan this year. Continue to seek help until you get help, until that chest pain has gone, until that breathing shortness of breath has resolved. So don't wait saying that but you are seeing doctor or but you are seeing specialist. Keep talking until you recover your health back to what it's supposed to be. Then I have a word, for specialists, for general practitioners, for healthcare generally, of the country generally. Please, when people say they practice multi-specialists, that is what they call jack of all trade and master of none. In this world, in this year's Nigerian Cardiology Society conference, part of it is that primary cardiovascular health care must be born, whereby people who have this high blood pressure, who have this diabetes, cardiovascular condition, physicians that have been trained towards a specific goal, cardiovascular health, will be the one on seat to reduce the burden. Mr. Moderator, you said earlier, the WHO, World Heart Federation, says 18.6 million are going to die from cardiovascular diseases. Isn't that too much? Is that not shocking for every one of us? This is a great burden. It's a great burden. And we need to begin to do decisive. Yes, we have primary health cares that does everything. But it is time to have primary cardiovascular care, whereby those who have these cardiovascular health and diseases can
Okay, it appears Dr. Ali is having some technical issues. We're trying to get her back. But just to, first of all, you can all ask questions. There's a box that you can type in questions. I can see some of your questions. Once she's back, she will answer a couple of them. So just to also stress what Dr. Ali has been saying, this year, World Heart Day. The theme is use heart to connect. It's all about using, I'm going to address everybody now, using your knowledge you already have, some which you've gained now from this presentation, compassion and influence to make sure you, your loved ones, and the communities, whether it's at home, at work, religious center, church, or mosque, the communities you're a part of, they all have the best chance to live healthy lives. Okay, I'll just go through the questions. Yes, I have a question here from one of us, and it says, does eating after 8 p.m. affect persons above 50? The answer is that yes, it affects. Okay, just a minute. Let me. I think Dr. Ali is back with us. Dr. Ali, just a minute. I will. Just hold on a little bit. Dr. Ali, can you hear me? Hello? Dr. Ali? Can you hear me now? I think your mic is muted.
Okay, can you hear me now?
Yes, I can. Good to have you back.
Okay.
All right.
My microphone was muted.
Okay, all right.
I can hear you. Thank you.
So we're going straight to the questions. Thank you for everything, man. We're going straight to the questions from the attendees.
Yeah.
So I'll start with one, I think, from a lady, from a woman. Let's start with that. It says, thank you, doctor. I admire your depth of knowledge. Please explain how to deal effectively with persistent postpartum high blood pressure.
Okay, persistent postpartum high blood pressure. Yes, high blood pressure shouldn't be persistent postpartum. It means she needs to be properly evaluated. She needs to be properly evaluated and managed. The pressure will come down with the proper medication and lifestyle changes. So she needs to present herself for proper evaluation and proper holistic treatment, with including medications, so that the blood pressure can come down to targets of 138. She needs to do that.
All right.
As soon as possible. Yeah.
Okay, thank you for that. To summarize the next question, what exercises can one engage in to keep the heart in a good state? Also, when we notice indigestion, palpitations, tiredness,
that's a very nice one.
What tests should the doctors administer for further investigations? Doctor, did you get that last part?
Thank you. And I didn't get the last part.
Okay.
The last.
Okay. Also, when we notice indigestion, palpitations, tiredness, what tests should the doctors administer for further investigation? Or rather, what tests should the doctors carry out to further diagnose the condition?
Okay, diagnosis. Okay, fine. I think the first part of that question is what kind of exercises is Dr. Ali doing to keep fit as a cardiologist? We cardiologists, we tend to also put ourselves in there. I will tell you that one thing I do regularly every day is to make sure that I can run on the spot. That's jog on the spot. Sorry. You can jog on the spot. You understand? And then if you have enough environment where you can walk around maybe like at least for 30 minutes around your environment. It could even be your car park, and just walk down from one edge to the other, from one edge to the other, timing yourself, for 30 minutes, and so on. But the most important thing with exercise is the consistency. It is 15 to 30 minutes you need to do, but the recommended one is 30 minutes for the aerobics. Walking up and down, for 30 minutes. That's recommended. And then he said that you can do it 3 times in a day, in a week. But I'm even saying, if you can do this every day, 15 minutes, it's okay. Every day, 15 minutes. But because of work schedule and so on, we don't want people to, that is, to be over-labor. But again, you can even do it in your bedroom. You can do something like this in your bedroom, jogging on the spot, smart jogging on the spot for 15 minutes on a daily basis. And then good enough, we have what we call this exercise, digital exercises on your computer, which you can follow. You can follow them on YouTube. Yes, on YouTube and so on. You can follow them for that 30 minutes period. And it's just, but the most important word is consistency. Consistency. So it keeps you going. It keeps your muscles stretched. You do stretching exercises too. So this is something you need to make a conscious effort. Those are the undertone, to be regular with it, to make a conscious, proactive effort in making sure you do them. So that is it with exercise. If you love swimming, you can do swimming for 15 minutes or 30 minutes. And if you are good, is a good swimmer. Yes, I have swimming pool in my house. So I've also learned to a certain extent to do some swimming. So you can do that. You can join swimming club. Please make sure you know how to swim. Swimming is a good heart health. It's a good aerobics if you are good at it. So those are these: jogging on the spot, walking, smart brisk walking, up and down. But the thing is consistency. 30 minutes. If you want to be every day, 15 minutes, 20 minutes on a daily basis. But if it's 3 times in a week, 30 minutes. 3 times each time you want to do it. So, but you don't need to run on the field or running will worsen especially for middle-aged people, might worsen the arthritis. Running might worsen, and then if you have instrument like a stationary cycle, might be okay. But those who have arthritis might also be disturbed by the pedaling. If you have treadmill in your house, then which is also good. Then jump on the treadmill. Be on the treadmill at least. We are just walking on the treadmill. So those are good things. But the consistency is what matters. So that is it for exercises. Then for I think the second part is the issue of what's the second part of the question?
Investigation.
The second part of the question, Mr. Moderator.
Yes, investigations. Investigations. Yes.
That these conditions. What do you do? For we the cardiologists, our tool of diagnosis is number 1, an ECG, resting ECG. That is done. Then number 2, then we have some cardiac work, blood work that we normally do. Troponin, and that's biomarkers, and then blood sugar, because they can present in different forms. High blood sugar can present with tiredness and weakness as well. And of course, they all contribute to cardiovascular health. High blood sugar, high cholesterol, lipid profile. So these are the simple but most important: uric acid, your kidney functions. Yes. And if you are doing the cardiovascular setting, you can do your BMP. That indicates your bowel. It's another biomarker. In this condition. So quite a few, that you can quickly do even your full blood count, a complete full blood count, because anemia can present itself with shortness of breath, and on and on. And in these days of COVID-19, we have introduced D-dimer acid, to quickly help us to appreciate what is the clotting profile. The clotting profile of that person. So to mention just a few, those are the things, and of course we have the hyperloading types that are necessary as the condition dictates. So That is just to mention a few. But the rest needs ECG, and of course echo for two, a simple, straightforward 2D Doppler, mode, transthoracic echocardiography is also a good one to be done. And of course, a chest X-ray, plain chest X-ray can also contribute, at a point in time. And if you don't want to do a scan, a chest X-ray, you can upgrade to CT scan, as the case indicates. I'm not saying CT scan is routine. No, not CT chest is not routine. But once there are other things that are in consideration, then you might need to do a proper imaging. You can alter the person, monitor the 24-hour BP. So quite a number on the plates. Thank you, Mr. Moderator.
Thank you very much, ma. All right, Dr. Ali. So just to mention that the person that asked the question about the postpartum hypertension, you're going to get a referral very soon. She'd like to get in touch with you. So I'll connect. All right. So another question on blood pressure. Mass? I didn't get that. Okay. All right. So I have another question.
I said I'm not women's health.
Yes. And I agree with you. So another question here, it says, I have a question. I have bad anxiety, which spikes my blood pressure only when I get to the hospital. This is due to an incident of loss of pregnancy in the past. At home, it's about 110/70 to 115/75. But when she gets to the hospital, it's at least 130/85, sometimes higher. I might eat healthy, exercise, but this spike in the hospital is a problem for me. My doctor said it's white coat syndrome. What can I do to manage this, and how do I control it?
Okay, that's a very nice one. White coat hypertension is a well-known entity by the WHO, WHO and all the international bodies. White coat hypertension, yes, it exists, and we always want to make sure it's evidence-based before we say, okay, you have white coat hypertension, you have no problem. Evidence-based in the fact that we want you to have what we call 24-hour blood pressure monitoring, whereby, okay, we monitor you in the hospital with the device. Then we say, okay, go home and with the device, 24-hour blood pressure monitor, and then also in your own environment, relax, do what you need to do, and then the monitor will record the blood pressure. And then you bring back the monitor, and then we evaluate and be able to appreciate that, yes, what the individual has is white coat hypertension. But there is a but, and the but is that if we say that it's a white coat hypertension that occurs only in the hospital, when we now do the necessary investigations like resting ECG, 2D echo, all the ones I've mentioned before, and there are indications for target organ damage, TOD. That is, some of our investigations pointing to the fact that though we say it is white coat hypertension, but we are able to see evidence, ECG, LVH, echocardiographic, concentric LVH, or something to point to us that the organs are already suffering. The cardiovascular health is already suffering from this so-called hypertension. Then treatment is important. Then it must be treated with well-known medications that have been so that is why we say treatment of high blood pressure is individualized. Individual cases, when you are holistically assessed, and then we come to a conclusion that, look, we cannot continue to put this under white coat hypertension. we need to do some decisive management, protocol. And if we don't, this heart continues to get hypertrophied, in which why it will come to dilate, and the individual might suffer, heart failure or even sudden death. And we don't want that because they are all preventable complications. Thank you, Mr. Moderator.
Thank you, Dr. Ali. Yes, I hope that answers this question. So the next question is this. Please, doctor, what are those heart-healthy diets that are good for our consumption?
That's a good one. Heart-healthy diet might not be friendly, but they are very good choices. What I will say essentially is to say that, number one, avoid taking heavy sugar, drinks, food, heavily, heavily, what I will say, adulterated with sugar. Avoid it. Avoid the use of too much of oil in your food. Too much oil in your food, whichever if it is good oil, avoid using much of it. What I'm trying to say again is portion control in whatever you eat. Then another one is taking quite a number of vegetables, greens, colorful food. Let it be a little bit of your rice, a small portion of your rice, and quite a lot of colors. Your green beans, your carrots, your cucumber, meat, with it, or your cabbage, in there is good. Fruits should be natural fruit choices, fruit punches. That is, you cut your pineapple, your watermelon, your whatever, you cut them and then take them like that, or punch them, or grind or blend them into a nice drink. Instead of you going to buy, packed foods. Like I don't want to mention names, so they won't say I am bringing down their business. But fresh fruits are good choices than packed fruits in the can, because oftentimes I always tell people, when you go to the supermarket to buy, you see all sorts. Read the content. You always read the label. Read the label of what you are buying. You see some of them are with a lot of sugar, lots of fat, lot of unsaturated fat, and on and on. So but there are choices, good choices to make, out there in the supermarket that can help your heart health. So by and large, the teaching is that, one, portion control. Our food is good, pounded yam, eba, and so on, but in small portions. Small portion. Don't heap up your swallow like this. Don't heap it up. Let it be small portions with lots of ewedu and fish. That's what we're talking about. And of course chicken. And of course meat too, but meat that they've removed a lot of the fat. Steak and so on. So those are kind of things we are talking about. And of course, if you want to take things in the supermarket, your milk, skim milk, look at what the contents are being put in the container of what you are, because the people who are produce them, they will give you varieties. Salmon in brain, salmon in sunflower oil, salmon, they will give you salmon in cheese, they will give you all the various. So pick the one that is of good health for yourself. And that is what we are talking about today. So that it won't be that Dr. Ali said we should not eat anything. No, I'm not saying that. But I'm saying portion control and choosing, less of all these, items are important. And of course, having to drink enough fluid on a daily basis is important. 3 to 4 liters of water, plain water, I'm not saying Coke is water. No, avoid drinking that. Take water. Good water is good for living. It's good for cardiovascular health. For 3 to 4 liters. Is, avoid eating late. Avoid eating late. And avoid eating heavy food, swallow to bed. Wait 2 hours before you go to bed after eating. Try and eat early. Eat your dinner early. Latest by 7, 8. You should have been through with your dinner. And if you need to take something thereafter, let it be more of vegetables. Maybe sliced cabbages, sliced carrots, sliced cucumber. Those are good things to eat. If you think you are arriving late at home, or you could eat just take ordinary vegetable, forage, sorry, with lot of fish, but with little palm oil. Palm oil with little. You can season it with locust beans, that's iru, instead of using lot of maggi, lots of all this seasoning. That's why it's a difficult thing, because the food preparation outside is not under your control. So it's not something you should be doing all the time. Eating out is okay, but it shouldn't be the norm. You should try and make sure you prepare your food at home. I'm not saying people should not eat out, but let it not be an everyday affair. Let it not be an everyday affair, so that you can have a control over what you eat yourself. And if you are going to dinner, you have many things presented to you, so pick the heart-friendly choices, and that is what it's. Dash diet, little salt. Do not add salt to your food on the table. Avoid adding salt to your food on the table. It's very bad. Or Maggi sauce. This Maggi sauce in the black bottle, avoid adding, because Maggi contains a lot of salt. So your seasoning should be in moderation, and it should be as natural as possible. You can season your food with what we call crayfish, so on. So these are what I will talk about.
Okay, thank you, Dr. Ali. So, hello, Dr. Ali.
Okay.
All right, so Dr. Ali, thank you. Our time is fast spent. I'll take there's some clinical questions, but I'll take a general one as the final question. Um, it's a very general question. Is there any hope that drugs that would cure cardiovascular diseases by researcher permanently? Any hope that will it be discovered?
There is no cure for cardiovascular diseases for now. There is no cure, but in cardiovascular diseases, the slogan is prevention is better. Prevention is better. There are quite a number of preventive modalities, and that is what we are discussing today. And that is the education. Because once the heart begins to enlarge, once the vessels are disturbed, these conditions are non-reversible. They are non-reversible conditions. They are non-reversible, but you can prevent it from developing. So that's the beauty of cardiovascular health. It's preventable, but once it has been discovered and it has developed and it is established, you can only halt it, the progression, but you cannot reverse it. Even with medication, it's not reversible back to the initial stage. There are medications that we issue out, that we prescribe, we only halt the progression, at least, and help good quality of life. It does not reverse it back to the initial stage. So prevention, therefore, is better than cure when it comes to cardiovascular health.
Dr. Ali, thank you very much. I think we've all learned from this presentation, and very insightful, very informative as well. Um, so there are other questions, but we're basically out of time. The ones that want to connect with you, will find a way to connect the attendees to you directly. So once again, World Heart Day, September 29. Thank you so much. I think I'll let Dr. Ali have the final
29th
say.
of September.
Yes.
September 29th is the World Heart Day. And as I've been saying, the hashtag for this year is use your heart to connect. Connecting to yourself that, look, I have a heart, I have the blood vessels, I need to do what is utmost for myself in terms of my lifestyle, in terms of what I need to do it to protect my cardiovascular health. And also educating others, telling others, especially husbands to their wives, especially women who tend to relegate their health issues to the background, should now begin to speak up. And the slogan also say that you do not rest until you have solution. Continue to speak up until there is what? Solution to your cardiovascular health. I am Dr. Ali. I am practicing at the Lagos Executive Cardiovascular Center, Lekki, Phase 1, Lagos. Thank you very much.
Thank you, Dr. Ali. So for all our attendees, like I said, I hope it's been very educational. So until we have our next presentation, have a lovely Friday and the rest of your weekend.
Thank you very much. Bye for now.